This is the pitch for the game Is There a Doctor on the Plane by Evolver Games. Is There a Doctor on the Plane is a casual virtual reality medical simulator where the player, a newly minted doctor, must handle an in-air medical emergency by making the right decisions and choosing the correct course of action to improve the outcome of the patient. In this first-person virtual reality medical simulator, players will interact with the patient, his family traveling with them, and the flight crew on a transatlantic flight. Players will be able to use in-flight medical kits through VR grab controls and move about the cabin of the aircraft to perform tasks. The decisions of the player will lead to favorable or unfavorable outcomes, and the scenarios will help real medical professionals gain confidence in emergencies where they may not have anyone to rely on but themselves. While the learning will be serious, the game will be loaded with humor and colorful characters to make the experience lively for players. Is There a Doctor on the Plane will use decision trees like in Mass Effect for interactions between the player and non-playable characters in the game. Players will be given, on average, 3 choices for each decision they have to make. Good decisions will increase the favorable outcome score, while bad decisions will decrease it. Players will have the option to work under a time limit or with no time limit. Players will also be able to roam around the cabin to search for and retrieve helpful items that they can grab using VR grasp mechanics. They may also need to position these items on the patient or reposition the patient himself using VR motions. Players engage in conversations with the aircrew and other passengers. By engaging with passengers, players will be able to create a clearer picture of events leading up to the emergency or identify valuable companions to help with the emergency. Players will be able to jot down clues in their notebook or ask passengers to join the effort to save the patient. Adding the right party members can help, while adding the wrong party members can increase the chaos of the situation, adding to the game's chaos meter. High chaos caused by poor or extreme decisions can lead to distractions that may decrease the favorable outcome score. This game will be designed for download on Windows devices and will require the use of virtual reality goggles. The genre of the game is a casual educational medical simulator. We'll be using Unreal Engine with visual scripting in the form of blueprints and C+ coding language, C++. The MetaQuest 3 will be used for virtual reality testing, and Perforce will be used for version control. The team is composed of myself, Rob Guido, as the producer, director, game designer, gameplay and AI programmer, UI designer, scriptwriter, and voice-over actor, as well as the research and subject matter expert. Some comparable products include Trauma Center, which is a casual medical simulator that doesn't rely on precise medical technique, but rather correct decisions and broad movements to perform procedures. Like this game, Is There a Doctor on the Plane? Is not designed to teach things like correct suturing technique, but rather focuses on wise decisions for materials and correct location of actions. Players can select a confidence rating before choosing to perform a procedure, and this will affect the success of the procedure. While the game is good for creating general interest in medicine, I would not recommend Trauma Center as a training material for medical students. However, our game will be used as training material. Another game to compare it to would be Amateur Surgeon 4, which is a comedic slapstick surgery game that uses crazy implements like a pizza cutter and salad tongs for surgery. However, some of the medical principles are sound, such as suturing large wounds while using glue for smaller wounds. You also can get partners in Amateur Surgeon 4, as you will be able to in our game. The art style will also be not quite as comic and silly, but in the comic vein. Triage is a game created as a simulator to train nurses to triage patients arriving at the emergency department. we will be inspired by this in terms of having our environment closely match a real-life environment. So the environment of triage is an emergency department, where ours will mirror that of a airplane. We also use algorithms to encourage people to make decisions according to best practices. Our features break down into our A features, which include player controls like moving around the airplane cabin by teleportation and or the option of smooth movement. Also, the player will be able to pick up items, push buttons such as on an AED, and also be able to make decisions using the VR joystick and buttons. There'll be sound effects to provide some context for the player, such as breathing sounds and slurred speech. There'll be decision trees that get activated depending on the decisions of the players, and the player wins if they reach a maximum favorable outcome or the end of the decision tree, or if their outcome meter drops to 0%. The favorable outcome meter is a prominent part of the game, and again, if it drops to 0%, it's an automatic loss. Players will be able to speak with other passengers in the flight crew. In our B level features, there'll be assistants, a notebook to write in. You'll be able to retrieve objects besides the AED around the plane and explore the overhead compartments and things like that. There'll be other medical procedures that you can do, such as apply an IV or take a blood pressure measurement. And there'll be a chaos meter in case you make bad decisions or erratic decisions, which can create distractions or even force the pilot to land the plane. And finally, the C features will be additional scenarios, emergency scenarios, including hypoglycemia, as well as even more medical procedures, including applying tourniquets, bandages, and minor suturing.